Mrs. Esra, we continue our conversation. So you mentioned about the therapy that being a focus of your company as well, AstraZeneca Indonesia. How does AstraZeneca align its therapeutic focus on oncology and lung health with Indonesia's top public health challenges, especially in reducing long-term healthcare costs? And can you explain more about the involvement of technology, for instance, AI, in this therapeutic?
Sure. So as you mentioned, lung health and also cancer diseases are among the highest burden diseases within Indonesia. There are multiple reasons, especially in lung health. Air pollution, also high smoking rates contribute significantly to that. Also in cancer space, breast cancer, lung cancer, and also gastrointestinal cancers are the main reasons for the cancer burden. In the lung space, we try to prioritize GP capability building, who are the general practitioners who are working primarily in the puskesmas across the nation, who contribute significantly well, and upskilling those general practitioners how to diagnose particular lung diseases, including the asthma, COPD, which is the chronic respiratory diseases, pulmonary diseases, obstructive diseases. So will enable to make sure that we diagnose them early, treat them early, to make sure that we contribute to the society and also the economy. In cancer space, we also focus on delivering the innovative medicines to Indonesia. Cancer space is moving towards more precision medicines, which is more targeted therapies. We try to understand what are the tumor drivers, mutational drivers that causing that tumor to grow. We try to diagnose those tumor drivers and try to bring novel medications that specifically target that area rather than less, side effects and more efficacious treatment to beat the cancer mutations. And in that regard, we also try to make sure that we deliver high technology AI, because in cancer space, we know that the earlier diagnosis, earlier detection of the cancer and earlier therapy will make sure that we save more lives. So that how we can come up AI digital solution, for example, X-rays, to recognize the incidental nodules in the lung at the earlier space, diagnose the patient early, treat effectively, and then contribute to the society and economy better.
Yeah, and speaking about health sector in Indonesia, most of Indonesian people, they having BPJS Kesehatan as their insurance. Can you explain more about the collaboration between AstraZeneca and BPJS Kesehatan?
Sure. We have many brands available through BPJS. So our first angle is to make sure that those innovative medicines is available in Indonesia as well, together with the other countries. That's number one that we are working. For the access side and availability in the BPJS, we try to comply the new regulations, which is the health technology assessment. Through the universities, key institutions, to make sure that our medicines deliver cost-effective solutions over the current treatments available in Indonesia and better outcomes. Once we prove this, our aim is to make sure that our innovative medicines are available to the broader patient groups in Indonesia, that we are working hand in hand with the Ministry of Health as well as through the BPJS.
How about your collaboration with other stakeholders, for instance, the Ministry of Health from other company, from other country?
So the Ministry of Health also working through the Center of Excellences. So what we do, for example, in cancer care, we work hand in hand with Hospital Darmais as the Center of Excellence for Cancer Care. How we can upskill the diagnostic capabilities, bringing know-how from outside outside Indonesia, and we have upskilled the diagnostic capabilities to make sure that we diagnose and targeted therapies are there within Dharma. Similarly, heart disease and heart failure is major burden in Indonesia. We are working hand in hand, institutions like Harapan Kita, Hasan Sadikin Hospital, how we can upskill the cardiologists on the heart failure treatment, which is not easy, so that again, how we can bring the know-how outside, also within the Indonesia, from the Center of Excellences, educate more doctors on how to treat heart failure and to make sure that more patients are benefit from those, right diagnosis.
Yeah, other than what you explained, what kind of investment or partnerships has AstraZeneca made to build a local capacity in Indonesia in terms of healthcare ecosystem? You mentioned about diagnostic improvement, data systems, education, literature. You mentioned about that. What kind of other investment?
I think we talk about many things: diagnosis, diagnostics, educating more doctors, and also working with the Center of Excellences. One other area I can mention is the prevention.
Okay, prevention.
Disease prevention, disease education. One other unique program that we launched in Indonesia called the Young Health Program. Because healthcare awareness comes from the early childhood, adolescence levels. So we initiated a Young Health Program in Indonesia in 2021 through our partners. So far, through the peer educators, over 1,000 peer educators, we have reached so far close to 90,000 young people, especially the high school students, how they can live a healthy lifestyle through the right habits, right eating habits, exercise habits, inform them about the potential causes of smoking, because smoking also starts early at those ages. So we are proud of this program and how it is delivered. And I think it contributes to the disease prevention, because we always know that treating the disease is way expensive to the community than eliminating the disease through the prevention and disease awareness and healthy living styles.
Okay, so the Young Health Program directly targeted to the people, not only the doctors, not only the hospital, but to the people directly. Directly
on the how to get healthy lifestyle habits in the young ages.
Okay, and how does AstraZeneca integrate environmental sustainability into its lung health initiatives? In terms of pollution and climate change also affect respiratory disease trends in Indonesia?
I think we are one of the leading companies considering the operating in a sustainable way. We are leading in sustainability. And as you mentioned, climate change, air pollution has also implications on the human health. And we believe healthy people only possible with the healthy society and healthy planet. So we have multiple initiatives in that space. One thing I can mention is the AstraZeneca Forest Program. Beyond delivering our medicines, we are leading company and pharmaceutical company. We have planted more than 11 million trees across the Citarum River, working hand in hand with the ministries. And we also trained over 70,000 farmers how to do sustainable agriculture, reducing the waste. And all those, to me, contributed to the society in a different way, aligned with our mission. Another thing, there is huge air pollution, and we know that one of the factors is the vehicles, right? Motorcycles, etc. Last year, we contributed 100% of our fleet with electrical vehicles.
Okay, fleets.
So our ambition is to become zero carbon this year, and also ideally carbon negative by 2030. Last but not least, we do have the manufacturing facility in Cikarang, and we also got the zero carbon certificates, which we also utilize renewable energy resources to our facilities to make sure that we operate in a zero carbon level, not to consume any further carbon emissions to the planet, and we operate in a sustainable way.
Okay, that's a lot of initiatives, from planting 11 million trees and then train all the farmers for sustainable agriculture, 100% fleets with EV, and then targeted carbon negative by 2030. Now let's make it short in 2025 to close this conversation. What is the shortest target for your company in 2025 with this less than 6-7 months?
We will continue to work hand in hand with our healthcare professionals, associations, institutions, Ministry of Health, as well as BPJS, to make sure that we contribute to the healthcare end-to-end as a healthcare partner in Indonesia.
Thank you so much, Mrs. Esra, for your time to CNBC Indonesia. We look forward for all the initiatives, and we hope that your company gonna bring a lot of good impact for Indonesian health sector, to be precise. Thank you very much.
Terima kasih, Syafin.
Ya, itu dia tadi dialog saya bersama dengan Presiden Director Astrazeneca Indonesia, Mrs. Esra Erkomay, dan kini kembali lagi ke Profit CNBC Indonesia.